Hi, welcome to the pre-liver transplant teaching class. We are here today to teach you a bit about liver transplant. This is a huge endeavor that you're beginning on, and we want you to feel empowered by this information. Please know that this is an overview of the entire program, and therefore there's a lot of information that we're going to cover today. Please try not to feel overwhelmed by this information, but just take it in and use it to help you along your journey. The entire process begins with an evaluation. The purpose of the evaluation is to determine if liver transplant is the next best step for you. Please understand that conceptually, if you have a liver problem, it makes sense that you could remove your liver and replace it with a new one that didn't have a liver problem, and you could live a long, healthy, happy life. However, it's not that simple, and it's really important for us to perform a thorough evaluation to determine if liver transplant is appropriate for your case. To introduce you to the team of hepatologists who will be managing your liver disease prior to your liver transplant. These transplant hepatologists are gastroenterologists who have had extra training in liver disease. They'll work with you in your pre-transplant journey to optimize your current liver function in preparation for liver transplant. Physicians are transplant surgeons. They, by definition, do the magic in the operating room. You'll notice that we have quite a number of transplant surgeons. That's because for deceased donor liver transplant, we use 2 surgeons, and for living donor liver transplant, we use 5. But please know, by being in our program here at the University of Rochester, we have a multitude of resources available for you to help you along your liver transplant journey. Probably an organ that you knew existed in your body, but you didn't realize had such a big impact until you noticed you had a problem with it. You may relate to some or many of these issues listed here, but please know that liver disease shows its face in many different ways for different people. At the beginning, your journey in liver transplant begins with an evaluation. What that means is we have to learn all about you. We do that by gathering information through blood work, imaging, a cardiac stress test, and health maintenance items. It's required that we determine there's no cancer anywhere in your body before we embark on liver transplant, understanding that you will have to be immunosuppressed for the rest of your life after your transplant. Here at the University of Rochester, we do ensure all of our patients are abstinent from alcohol and all drugs not prescribed by a doctor. Regardless of your reason for liver disease or your reason to be here, it is a requirement amongst our program that both before and after liver transplant, you would not have any alcohol or drugs not prescribed by a doctor. We also will perform frailty testing to assess your functional status to ensure that you're strong enough physically to undergo liver transplant. This is not meant to exclude you from transplant, but it is important to determine if you meet clinical criteria for frailty. This might mean you need extra support with nutrition or physical therapy, so we want to identify folks within this subgroup so that then we can make sure you're successful with liver transplant. After we gather all the testing, we'll have you come to the clinic and you'll meet a multitude of people during that day. After we have gathered all the information that we can, both through testing as well as visits with our team, we'll sit down as a committee and determine your candidacy. This seems pretty black and white, but it's a really thoughtful discussion to determine if liver transplant is the appropriate next step or if there's a reason why we should not do a liver transplant. The coordinator group, like myself, will be following up with you by phone after the selection committee is done on Friday. Our intention at the University of Rochester is to offer liver transplant to everyone who needs one. From there, we'll continue to follow you in our liver transplant pre-clinic while you wait for a liver transplant. Please know that while you wait for a liver transplant, the United Network for Organ Sharing, which we call UNOS for short, makes all the rules for fair organ distribution and regulation in the United States. It's important to us that we certainly follow these rules and we assist you throughout the process. Please know that you're allowed to list at more than one transplant center if you so wish. While you wait for a liver transplant at the University of Rochester, it's important to keep close communication with your pre-transplant team. This means that if things change demographically with where you're located or your phone number, you are expected to update your pre-transplant team. In addition, if you're considering changing your insurance, you should reach out to your pre-transplant team before you change your insurance. We'll want to make sure that we participate with your new company and we have your auth all ready to go so that it doesn't interrupt your listing at any time. We will remind you to update your lab work as required by the United Network for Organ Sharing. And you are responsible for updating your health maintenance items as required by your local teams. If you're not transplanted by this time next year, we will require you to repeat all of your annual testing, including your cardiac stress test. As a reminder, we'll require everyone in our program, both pre and post-transplant, to abstain from alcohol and all drugs not prescribed by a doctor. We don't recommend getting on Google for all of your information. We do recommend getting on the SRTR website. This is the Scientific Registry for Transplant Recipients, and it's a reputable website which can provide you a plethora of information, specifically data on our outcomes and the outcomes of other liver transplant centers. Organ allocation in the United States is largely based on a system called MELD score. MELD score is a calculation of lab values which goes from 40 to 6. 40 is the highest MELD score that you can be awarded, and that means that your liver function is very, very poor. 6 is normal liver function, and that would be found in healthy liver tissue. These are the criteria that go into a MELD score. Please know that organ allocation begins at the top, near the 40, and then trickles down to those with a lower MELD score because in theory their livers are healthier and could wait longer compared to the 40. Average MELD score for deceased donor liver transplant at the University of Rochester is currently 34. Most deceased organ donors are brain dead. They have suffered complete and irreversible loss of all brain function and are clinically and legally dead. This is called a traditional donor. Some patients with non-survivable injuries to the brain never become brain dead because they retain some minor brainstem function. Donation in such cases entails taking the patient off the ventilator, typically in the operating room. Once the patient's heart stops beating, the physician declares the patient dead and organs can be removed.
Their families wish to donate organs and can be done in such cases where the patient is taken off the ventilator, typically in an operating room. Once the patient's heart stops beating, the physician declares the patient brain dead, and the transplant team can remove the organs for transplantation.
With a MELD score near 34, it can be challenging to find a suitable deceased donor. For these patients, we recommend pursuing living donor liver transplant. This means asking folks to consider donating a portion of their body to save your life. In living donor liver transplant, individuals between the ages of 18 and 60 go to the operating room with the intention of donating a portion of their liver for your body. We still remove the entire cirrhotic liver contained within your body, and we replace it with a portion of your donor's liver. In order to increase the opportunity for liver transplant at the University of Rochester, we do consider donors who are considered high risk. Largely, this means donors who could have high risk for transmitting a disease to you as the recipient. This does include hepatitis C virus, as the hepatitis C virus could now be cured. The perfect liver is found for you. The coordinator on call will notify you by phone. At the time of that phone call, they will give you all the instructions that they can. The timing tends to be a big question. How much time do I have to get to the University of Rochester? And the answer is, it depends. Sometimes you'll have to come to the hospital immediately. Please know that once you arrive, the surgical team will obtain consent for the surgery. University of Rochester, we have our own dedicated team who are specialty trained in liver transplant. Please know this extends far beyond our liver surgeons, but does include nurses, scrub techs, and anesthesiologists. Liver transplant surgery is a very long process, typically lasting about 8 to 12 hours. After you're asleep, the anesthesia team will place a breathing tube and big IVs in your neck because the medicine has to go straight into your heart. There is a large abdominal incision which is required to remove your entire liver. After the new liver is replaced, you'll be closed with staples and a small drain will remain at the bottom. Everyone who receives a liver transplant at the University of Rochester goes up to the surgical intensive care unit after the surgery. This photo shows the incision, which is used to remove your old liver. On the left, you'll find a cirrhotic liver and the gallbladder, which is also removed with liver transplant. On the right, you see a healthy liver and the multiple connections that are needed in order to sew this new liver back into your body by hand. Please know pain is a normal occurrence with a liver transplant surgery. Every day, your body should continue to improve and you should require less pain medication over time. It's Important to have a general idea of what will happen while you're in the hospital after your liver transplant. Every person who receives a liver transplant goes up to the ICU and spends at least a couple of days there. After their time in the ICU, they'll go to our special transplant floor and continue their rehab as well as their education of their new lifestyle. After discharge, people go home and are seen once a week in our post-transplant clinic. Lab work is required to be completed twice a week. You'll need lots of help at home and you won't be able to drive back and forth, so we require a 24/7 support system for at least the first 2 weeks of being home after your liver transplant. It remains a complex surgery that is accompanied by significant illness. Complications are sometimes unavoidable. Complications of the early postoperative course can be from the liver graft not functioning as well as needed. In very rare circumstances, a patient may need to be relisted for transplant. There also may be leaks from where the blood vessels and bile ducts are sewn together. Again, in rare circumstances, a clot may form in the artery and you may need to be relisted for a second liver transplant. Later complications include strictures or narrowing of the bile duct. This may need to be stented in the future. You'll receive medication to prevent rejection and may require change or increase in medication if rejection occurs. You will learn how to prevent infection as well as early detection and treatment of infection after your transplant. Ask your provider if your liver disease can reoccur after transplant. Medications have side effects. The following are some more common side effects associated with the immunosuppressants we use. It may be possible to control these effects by changing doses or medications. By showing you photos of our energetic and devoted surgeons. These folks are our superheroes. While you're here at the University of Rochester, please ask all of your questions so we can help you learn about the entire process. The goal of the liver transplant is to restore you to a good quality of life. Please expect 6 months or more to recover before you'll feel fully healed after your transplant surgery. You may be able to resume normal activities or go back to work a few months after your surgery. How long it takes you to recover may depend on how ill you are before your liver transplant.